Hello, everyone. My name is Miss Tenora. I'm your dental instructor. And today we are going to start on page 917 in your green textbook. We will start on chapter 39 today. And that chapter is specifically on laboratory materials and techniques. Okay. So before we get started, go ahead, get open to that page and get your highlighters ready to highlight notes. Yes, as an assistant, you are going to sometimes have to get impressions on your patients. Impressions can be for dentures, partials, crowns, bridge, implants, braces, any type of appliance that has to be customized for your patient's mouth we have to get those impressions and wax bites and things like that. So in order to do that, we have to kind of have an understanding of, you know, as your objective says today, identifying the material that's actually used in a laboratory. Okay. And also understanding the knowledge and having the skill to actually create, to take an impression, how to mix it, what to use to mix it, just how to have the skill to approach that when you get in the office. Now, I want you to remember these things take time to learn. It does not happen overnight. So I want you to remember that and relax. It's nothing to freak out. And while we are online, this is uh, a good way to learn, actually. You have a lot of ways to learn how to take an impression. But for right now, we're not going to focus so much on how to take the impression. Let's get into um, just knowing the material. That's the first step. Okay. So I'm going to go ahead and share my screen, and I'm going to get into the introduction. If you turn to page 918, get your highlighters ready. It starts off by saying a number of materials that are used by dental assistants, specifically um, in the dental laboratory, are not used in dental treatment rooms. So what that means is you have material that are specifically used in the lab and not in your treatment room where you actually perform your procedures on your patients. So there's a difference, okay? It also says right here, it says other materials are used initially in the treatment room, and also they're taken by the dental assistant to the laboratory. What that's saying is sometimes you may have to take material from the lab into your treatment room to properly take an impression or do treatment on your patient. So sometimes we have to cross the two. We have to take material from the lab, bring that in the class, not the class, I'm sorry, the treatment room, and vice versa. When you're going to break down your room after your patient disinfected, you have to bring the materials and all the instruments that you use to the lab to be cleaned and scrubbed. So sometimes we're going to have to cross the two, but we want to make sure that we do that properly. Okay. I'm just going to scroll up a little bit. It says, of course, you will be taking many models in the dental office laboratory, where the laboratory technician, that's you, um, completes the procedure. Now, some offices have it to where the assistants only assist the doctor and take impressions. And then they may have one or two assistants that are lab techs and they only work in the lab. They may have an assistant for only sterilization, sterilizing instruments and things like that. So some offices have a person or persons for each different area in the actual lab. Okay. Few things I really want you to highlight this. It says it is always important to assure that cross-contamination does not occur when working in the laboratory. You never want to take take a chance of cross-contaminating impression trays, just anything between your patients. So you want to, as it says, the dental assistant must pay special attention when taking materials from the treatment room to the lab. You want to make sure. So for example, if I have a patient that's coming in for dentures, I know that I'm going to have to take impressions. Okay. So you want to go ahead and get everything that you need set up on a tray specifically to take impressions. Bring that into your treatment room. Okay. After mixing, taking your impressions, you want to definitely wrap your impressions up, put your patient's name on that wrapper, and make sure that you don't mix it up when you bring it back to the lab with someone else's impressions. Okay. You don't want, because that patient is going to have to, that impression that you took, we're going to have to pour it up with stone, send it to the lab, and they're going to create a model from that impression. Okay. They may send us a denture seated in wax for your patient to try it on, right? So we don't want to take a chance of having someone try on someone else's teeth. So you want to be careful. So always pay attention to what's clean and what's not. Put names on impressions so that they don't get crossed with someone else's impression. You just keep track of that because that's very important. Okay. Um, and you don't want to have to explain to your patient why they had someone else's dentures or partials or crowns or whatever it is inside of their mouths. That is very bad. Okay. Moving on. Um, it says any dental assistant who has skills in performing laboratory duties, okay? And that's whether you are assessing his or her employer, regardless if it's whatever doctor it is, okay? The better cross-trained the dental team members are, the better the office will function. So if everybody has an understanding of what is to be expected, then therefore there shouldn't be any reason for miscommunication, um, being dealing with cross-contamination, mixing patients' impressions. It just makes it flow better. Okay, so that's pretty much what you're going to be addressing in this particular chapter. As you can see, please highlight those valuable points I gave you. And here, the last thing it says, a number of basic functions in the dental laboratory are routinely performed by the dental assistant, such as pouring or trimming a study model. When you hear that part, that means you're mixing material to take an impression, and then you have to pour it up with stone. Okay. Once it gets hard, you may have to trim off like extra little um, stone that you don't actually need. Also, that stone, that's what creates a study model for the lab to create a denture, partial crown, bridge, whatever it is that you're making. Also, you will get the opportunity. I know some doctors, they prefer to fabricate their own custom trays. It's just, I guess, a mind thing. But if you build that relationship where your doctor trusts you to fabricate the trays, then I'm sure they're gonna train you on that. So that's nothing to be nervous about. Remember, this is a learning process, even in school, even when you get your job, it's a learning process. No one wakes up just knowing this stuff. Okay. So I'm pretty much done with that part. So we are going to get into alginate materials. Okay. So let me click out of this and let's get into the alginate materials. So I'm going to get my little helper to kind of read a few things for us today, and then I'm going to talk. I find that sometimes I go in and out, so I think with this voiceover, it will help you get a better understanding, and then I'm going to explain it. Okay. Okay, let's stop right there. Okay, so right now you're in Louisiana. Louisiana has certain guidelines on what a dental assistant can actually do. Other states have their own guidelines. So how do you figure out what you can and can't do? That's one, getting with the your employer, whatever doctor you're working with. They can definitely let you know what they'll allow you to do with what you can't do. Now, if you want to go as far as researching it, looking up what's the requirements, which you can and can't do, you definitely can do that. But here, I've been an assistant in Louisiana for a very long time, many, many years. And I have mixed impression material. I have loaded the tray in the material. I have passed the tray to the dental assistant to place in, I'm sorry, the dentist to place in the patient's mouth. So it's almost like every day you're going to be in the office. Things are going to almost consist the same when it comes to the lab part of it. The only thing that would change is the material. The brand could change, but you may still do the same thing, same impressions. You would take same way, same form. Only thing changes maybe every once in a while is the material. Okay. Now it's going to tell us a little bit more about alginate material. Okay. Okay, so if you look on your page, page 919, and you look at figure 39.1, it shows you a fall bag, a plastic container of the alginate, and a few measuring devices that actually goes with it. So when you do get your alginate, they'll either come in a bag or containers for you to preserve it over time. They only last for a certain amount of time. They do have an expiration date just as well as everything else that we use. Okay, so I'm going to go ahead and pull that up. It's going to show us that exact picture. So here it's talking about the mixing alginate with the mixing device. So one, you see here, you want to have gloves. You want to wash your hands. I'm sorry. You want to wear gloves and a face mask. That is important when you're taking and mixing an alginate impression to go in a patient's mouth. Okay. And then it goes in to talk about the procedure and how to perform, how it would actually be performed by the assistant in whatever state allows you to do that. Okay. It tells you the supplies. So of course you're going to need, as we have in the lab, we have a flexible spatula, okay? Or in some places use disposable spatulas. The flexible spatula, 9 times out of 10, it can be sterilized, and you'll know the difference between a disposable one and one that can be sterilized because it'll be plastic, and that means you can only use it one time. You want to use a flexible bowl. It's going to show you exactly what all these materials are. So a flexible bowl, that's what you're going to be mixing it in. You definitely want water and a powder device. You want to be able to properly measure those particular items. So here it's telling us to look at figure 30, 39.7, and 39.7 is actually on page, let's see. 39.7 is on page, I just have it, you guys. It's on 925. Okay, but I'm gonna go ahead and click it here so you can see exactly what I'm talking about. So here, so this machine here, so you have your flexible spatula, you have your bowl, your flexible bowl, and here is that amalgamator mixer. And what it's not necessarily mixing, it's a vibrator, and it pretty much helps you be able to mix it properly as opposed to doing it by hand. Okay, it does show you those techniques on page 922, how the Alginator 2 is used and how it's actually mixing the amalgam. Okay, it does show you that. All right, so those are the types. That's one of the particular items that you're going to use. Sometimes your office may offer that and they may not. They may say, okay, they can actually mix this by hand. So I'm going to go ahead and allow them to mix it by hand without using the vibrator to actually mix the material. Okay. It does show you the procedure as far as manually, and that's with your hand. Okay, once again, you want to wash your hands always. You want to make sure you have your gloves on and your proper PPE. Okay, you still need the same items here. Okay, it's telling you the preparation. And all of these things are actually, you look at figure 39, I'm sorry, not 39. All of these, so here are your trays. You have, and right now we're on oral surgery tray, but we just finished crown and bridge. It's okay. So right here you have your trays, your different alginate trays. They come in different color sizes. Your stainless steel trays here, you absolutely can sterilize. The plastic ones you can't, it'll melt. So that means it's a single use unless they have the solution to sterilize it. To sterilize the plastic ones, there is a solution that you would actually scrub it and have it sit in a solution for 24 hours that would absolutely sterilize it. But as you can see in the tray, so this tray right here, this is a disposable tray and this is your upper tray. How do I know that? If you look in the center, it gives you a palette. Here would be your lower tray and it has an opening at in the center for the tongue and the floor of the mouth. So here's a max tray, here's a man tray. Same thing here, a max tray, man, man. And here's your quad tray. Your quad tray will only take an impression of your posterior teeth. It won't take the full arch upper and lower. So that would be the difference on the actual tray. And this is on page 921. Okay, it shows you on 921. All right, that pretty much concludes that area. Now here, it's showing you on page 920 where some places actually don't really, it's your doctor's preference. They don't use the powder. They actually have a material already mixed in a tube. What you're gonna have to do is you're gonna have to go, just as this assistant is, you have to load the tray and then you have to bring it into the patient's room and have them bite in the tray. So that's a little easier. Some offices, like I said, provide that and not all of them do. Some of them prefer mixing it right then and there. It's just your doctor's preference. Now, this is the machine. Over time, you will have to load it. It lasts for a while. You may, depending on how many impressions you're taking through a week, one tube could last 2 weeks. You just have to keep track and reloading it. But other than that, I think this is probably by far one of the easiest ways, because you don't have to be nervous about mixing it and running out of time and it gets hard on you. Okay. Now, here is a picture right here of some of the material that you would actually have, like you're mixing flexible bowls. Here's your flexible bowls. This is what you would use if you were manually mixing it. And then here would be your flexible spatula. Okay, so there's so many different ways that you could actually be successful in actually taking impressions. It does not have to be rush all the time. I do want you to take some time on page 918, and I want you to go through your advantages and disadvantages of alginate. There are some good and there is some bad. And I want you to highlight that. Now, the one disadvantage that you need to remember and always remember is that the alginate itself, and I will kind of scroll down so I can be on the same page with you guys. The alginate is a fantastic way to actually get, a really good impression. Okay. The one issue is, what if you don't take the impression correctly? Okay, that's the only thing that you have to, worry about and be concerned. Now, not taking it correctly, don't be nervous about that, because if you're going to be in the office, once you take that impression, you show your doctor before we dismiss that patient, is this, what you need? Then you're fine. And I'm sure the doctor will say, no, you're missing this tooth is cut off, or it's a little crooked, or you need more of the tooth structure, you need the gum line. Then that's when the doctor say, go ahead and retake it for me before we let the patient go. So getting a accurate impression is very important. We are going to learn how to do that. That it's not hard at all. If I can learn it, you can learn it. Okay. So I'm going to stop sharing my screen now. That pretty much concludes the first part of this chapter. Just understanding what an alginate impression is. An alginate impression is what you would actually take a molding of your patient's teeth, upper and lower. And it's not just the teeth, it's the gum line, how high up that arch is, how low the arch is, how many teeth are there, do you have some sharp, do you have some long, which way your teeth turn. It pretty much gives a full detail of a patient's mouth. You want a full detail of the patient's mouth because you want to be able to give that patient a nice fitting denture, a nice fitting partials. Even though they're gonna have adjustments, you still want to be able to do those things properly. Okay, so I will be listing a few questions on Edmodo with this video. But if you have any questions or concerns, please feel free to contact me, and we will definitely go over whatever it is that you need to get a better understanding of what this chapter is actually talking about. As always, I believe in you all, and we are taking this one day at a time. I'm here to support you fully when it comes to becoming a dental assistant. So feel free to contact me, and you're never bothering me. Okay, so till next time. This concludes this first section in this chapter, and this is a really good chapter. So I'll talk to you guys soon, and have a great day.